dollars do not exist because of that people simply do not understand what adult daycare is. You know, we know what schools are for kids. We know what child care is. We know what, in many cases, assisted living is because they've got the big, beautiful buildings and things like that, and a lot of people use them. But adult daycare has not been that viable in the state of Oklahoma.
I'd like to see us as a state put more money into the adult day health care program and doing it not only because we see the value to the participants, but recognizing what it can do for your state.
It still costs the state less to subsidize adult daycare than it costs the state to subsidize a nursing program or a home health care program.
Unfortunately, the state's fiscal options are so limited right now. I'm not sure where the money would come from, but you know, any dollar that's put in the adult day health care program pays off really, I think, very well in terms of a return on investment.
And you hate to talk about tax. Geez, you hate to talk about adding a tax. But is that what is going to fix this problem?
The state legislature doesn't look at it as a viable alternative yet. I think some do, but the others don't, simply because they've had no contact with adult daycare.
Naturally, the people you want to blame are the people who distribute the money, but there's just so much money to go around, and you have so many people pulling at your coattails out here that education, the state employees, and others, and all of them need more money, quite frankly, just as our seniors do, just as the type of care that we give in the nursing facilities. But I happen to be an advocate for the seniors, and I'm going to fight hard to see that we get the type of funds that are needed.
What's created that, of course, is just this continual demand for adult day health care service with no new money being pumped into the system. So inevitably, we're going to continue to see demand outpacing our ability to finance this program.
It needs to have adequate financing so that it can develop all over the state of Oklahoma. And at this point, it cannot.
If I were a legislator, I would rather see $1 million going to adult day health care and let a few more potholes develop on an old rural highway than to put that $1 million into transportation to cover those potholes when you're talking about lives versus some innate object which is still going to be there tomorrow.
The way the contract works is they have an allotted amount, but they don't get that money at their facility. We keep the money and they claim against it. So when I have a DHS eligible participant in my center and they attend all day long, every day for the month, at the end of the month I bill DHS.
It just makes it literally impossible to understand how we're going to make it. I mean, we just barely made it from April to June. We ran out of money in April. So that was 4 months of no money. And thank God for United Way and the county commissioners and our fundraising efforts that we made it.
They have to run a business and they have to be able to manage their budget and fundraise and bring in these other pots of money because the state budget is not a guarantee. If the state gets cut tomorrow another 10%, we'll have to make cuts. And that's not good for anybody.
Like I said, I don't think even the legislature could fully fund the demand. But they could take some steps in that direction, which I think could help create momentum for the program. And I think there are a lot of options that they can look at. And I think sometimes the mentality is if we can't fully fund this thing, we're not even going to touch it. But no, that's not our plea to them. It's give us just a little bit more funding and watch how much we can do with that.
As we grow older, if all the people in the state of Oklahoma, the aging individuals, go to nursing homes on state dollars, we're going to go broke in the state just trying to keep up with it.
It costs less to keep people in their homes, considerably less than it does to put them in a nursing facility.
The state pays a fixed rate of $45 a day for adult day services. A nursing home cost to the state is $107 a day. So it would greatly benefit the state to put more money into adult day services, and so that people are able to remain in their homes, the homes of a loved one, and receive this services. It would save the state a lot of money.
Let's see it.